This is another milestone week in our state. Vaccination is now open to all Iowans. Those 16 and 17 years of age can receive the Pfizer vaccine, while those 18 and older are able to have any of the 3 vaccines currently authorized for emergency use in the United States. Also this week, we have received our biggest vaccine allocation to date, 160,770 total doses between those that have been sent to the local public health departments and pharmacies that are participating in the federal vaccination program. Included in that allocation are 45,800 doses of Johnson & Johnson vaccine, and that's almost as many doses this week than what's been administered in total since it first became available. Those Johnson & Johnson doses will allow us to continue the remaining employer vaccination clinics, begin vaccinating college students this week, and support our local public health department's efforts to vaccinate hard-to-reach populations. However, the White House COVID response team did inform governors yesterday that we are going to see a significant reduction in J&J doses next week, and that we should expect lower allocations until the end of the month, when the weekly supply should increase to 8 million doses nationwide, so 2 weeks of reduction in our J&J doses. Until then, we'll adjust our plans accordingly over the next few weeks, but J&J will continue to be allocated for college vaccinations and others who may benefit from a single-dose vaccine. By doing this, we're ensuring college students and young adults are vaccinated as soon as possible, and that will help keep the virus activity low and manageable until a higher percentage of Iowans are fully vaccinated. Much of the recent uptick in positivity cases, not only in Iowa, but we're seeing this nationwide, can be attributed to individuals that are 18 to 24 years of age. And while many of them will experience only mild symptoms, they risk spreading it to others, including older coworkers, family members, or their parents who could become seriously ill. In fact, the highest percentage of current COVID hospitalizations is now often among adults in their 40s, 50s, and 60s. 61% of all Iowans currently in a hospital for COVID treatment fall into those age groups that I just mentioned. While hospitalizations remain stable overall, the demographics of those needing to be hospitalized have shifted from older adults to middle-aged. Fortunately, a large percentage of Iowans 65 and older have now been vaccinated, and we're seeing, as we talk about every week, positive results because of that. But the vaccination rate among middle-aged adults is lower. We're just seeing 35% of Iowans in their 40s and about 39% in their 50s have had at least 1 dose of vaccine. So now that the vaccination is open to all Iowans, we have an opportunity, and really we have a responsibility to change that. So I'm asking Iowans, if you're comfortable, please take the first vaccine that's offered to you rather than wait for one that you believe is better than the others. Every one of the vaccines, they are safe and effective, especially at preventing serious illness that can result in serious hospitalization and death.